Good morning, everyone. This is Maureen from OT. I just wanted to make a quick video to talk about the Dr. Brown specialty feeder, which is new to a lot of staff. So historically, in-house, we've used the Haberman bottle for babies with cleft and lip palate, or both, or we've used the pigeon feeder. So we're trying to be a little bit more consistent across the board and a little more evidence-based in the bottles that we choose. So we've transitioned more to the Dr. Brown specialty feeding system for babies with cleft lip and palate or palate. This is the bottle system that the doctors at the Cleft and Lip Clinic prefer, and it's the bottles that they typically give families when they get there. I know there are sometimes exceptions, but just to give a little backstory on why we're using this bottle system, this system allows for consistent and reliable flow rates, and it works really well. It's very infant driven, so it's not requiring manual assist from an adult. It's the baby driving the feeding, which is the reason we've gone to that. So it looks very much like a regular Dr. Brown system with the parts that we have. You use the same bottle nipples and the same flow rates. So we've got the ultra preemie, newborn, level 1 and level 2 nipples. Primarily for cleft lip and palate kids, we're using either the preemie, the newborn, or the level 1 nipple. I wouldn't expect us to need one that's any faster or slower. But the magic of this bottle and the confusion that's sometimes happening on the floor is people get a regular Dr. Brown bottle, but they don't have the blue disc. Or people are grabbing Dr. Brown bottles for typical kids and taking bottles that have this blue disc. This blue disc is the magic of the Dr. Brown specialty feeder for those cleft and lipped kids. So when you see this disc, this is what it's for. This bottle system is for those kids. On 7, I don't know where they're going to be stocked, but potentially they're going to be in the lactation room. And then on 9, we're going to have a couple of these kind of tucked away and labeled for cleft lip and palate. Please, please, please only use these with those kids, because there is an added expense to them, and we only carry so many, and we don't want to be using them with the traditional Dr. Brown bottles on the floor. So to use this, you're going to take the disc, push it into the top of the nipple, and make sure it's flush. The pointy part is down, and then it just looks nice and flat on the top. You put it in the bottle, or you screw on the bottle top after putting the guts in. You pinch it and dump it. You do that a couple times. Once you do that, then you can facilitate a rooting response and then get the baby to latch and suck. And then if you need anything, just give me an email, maureenhennessy@crouse.org, and I'm going to attach some info along with it. Thanks. Bye.